A very
Yeah,
good evening to one and all present over here. Uh, Today's presenters are Malvika Jain and Sai Anurag Rongolla from second year. They will be presenting the paper Effects of Phototherapy on Serum Magnesium Level in Neonates with Indirect Hyperbilirubinemia. We are glad to have Sahana ma'am from the Department of Pediatrics, and we are glad to have our postgraduates from the Department of Pharmacology, Shreya Bhatt ma'am and Dr. Karthik. Yes, Malvika, you can
yeah,
go ahead.
right. Good evening to one and all present here. I'm Malvika Jain, and today myself, along with my batchmate Anurag, will be presenting a journal club meet on the effects of phototherapy on the serum magnesium level in neonates with indirect hyperbilirubinemia. This was published in the International Journal of Pediatrics, which is a PubMed Central Index journal. So we'll be dividing our JC meet into like four into this outline, which comprises the introduction, where we talk about the basic overview of the study and give an introduction and insight into the basic knowledge of this paper. After which we'll go into the methodology, where we talk about the materials, methods, uh, etc., used in both the therapeutic aspect as well as the research aspect. After which, we'll be talking about the results, where we speak in detail about the statistical analysis, which helped us to come to a proper conclusion with regards to the results of the study. And finally, the conclusion, where we like finally conclude with the result and also talk about any limitations and the further scope of this paper. So, firstly, the introduction. So before heading to that, we'll try to understand the title. So in the title, you can like see a few words. While be explaining those in detail. Those are like the medical or the technical terms per se. So hyperbilirubinemia is an increase in the bilirubin levels by greater than 5 milligram per deciliter per day. This was the exact definition given in this study also. And coming to hyperbilirubinemia, it's of two types actually. One is direct and the other is indirect. So, in the direct hyperbilirubinemia, we have bilirubin in the conjugated form, and in indirect hyperbilirubinemia, we have bilirubin in the unconjugated form. So, conjugation is a process of detoxification where the xenobiotics or the substances that are harmful to the body are detoxified. They are made more water soluble and therefore more excretable, because whenever it's water soluble, it's easily excretable in the urine and the feces. Right. So over here, in indirect bilirubinemia, as I told, the bilirubin is in the unconjugated form. So because of which it is less excretable, and therefore it gets deposited because it has high affinity to the receptors in the basal ganglia and the membrane of the neurons. Because of which it leads to neurotoxicity. Now coming to phototherapy. So phototherapy is basically photo plus therapy. Photo is light, and therapy is obviously the therapeutic use of something whenever it's used to reduce the symptoms of a particular disease. So here, phototherapy reduces bilirubin toxicity. It has always been one of the most common means by which we like eliminate jaundice in the newborn. So here what happens is that the optical energy, that is because of the light, it converts bilirubin into easily conjugated isomeric forms. So because of which it's easily excretable. Okay. Uh, Now coming to some of the alternatives to phototherapy. So why do we actually need alternatives to phototherapy? Like why can't we just use phototherapy? Because from a very early age, we've always seen, people exposing newborns to the sunlight so that, they get the light energy and thereby decrease the jaundice or hyperbilirubinemia in technical terms. So the reason is because it has come under the purview of under the purview of research that phototherapy has been having a lot of complications, which include hypothermia, diarrhea, effects on the cytokines, interleukins, and vitamins, and also ocular, that is dealing with the eye, and dermatological, that is dealing with the skin. So these complications occur because of phototherapy. So that is why we've been trying to find alternatives to it. So currently the alternatives include phenobarbital and clofibrate. But however, even these two are not used because it's not backed by significant research. So it's used very rarely. And apart from this, blood transfusion is sometimes used, but that is also used only when bilirubin is like really high, and phototherapy cannot control the level of bilirubin there. So, like coming to the conclusion, like only phototherapy is greatly used as of now. So coming to magnesium, our study, it tries to find out whether magnesium could either be used as an alternative, or if not an alternative, at least as a supplementation to phototherapy. So effect of phototherapy on serum magnesium is less investigated, and that is what our study tries to explore. Okay. So as I had already mentioned about magnesium, before we venture into magnesium, we also need to understand what NMDA receptors are. So NMDA basically stands for N-methyl D-aspartate. So this is a type of glutamate receptor. Okay. And this is present on the neuronal membranes. Why this is important is because bilirubin exerts its toxicity by binding to the NMDA receptor. So once bilirubin binds, it causes some effects, which include the overactivation of this receptor, and also that the degradation of ion complexes, which consist of sodium and calcium channels. So these get degraded because whenever a substance repeatedly acts on its receptor, it causes overactivation and finally fatigue. Right. So this is what happens here, and that is why we see a lot of neurotoxicity and neuronal degeneration whenever bilirubin binds to the cells of the brain, particularly the basal ganglia. Now magnesium here. So magnesium acts as an NMDA receptor antagonist. So what happens here is that magnesium competitively inhibits bilirubin from binding to the NMDA receptor. So if there's like high level of magnesium, magnesium would bind instead of bilirubin, and bilirubin would not get a chance to bind to this receptor. Because of which the toxicity of bilirubin can be significantly reduced. Now coming to like why the study really focused on neonates rather than any other age group is because neonates do not have a very well formed blood brain barrier. So BBB is basically a barrier, as the name suggests, between the blood or the plasma and the brain in such a way that the toxic components in the blood or the plasma cannot penetrate into the brain. It's a barrier that protects the brain. But in the neonates, it's not completely formed. And one more thing, the BBB is formed by protective cells, which include astrocytes and other neuronal cells. Right. Uh, the results include the protection from hypoxic and neurotoxic effects of bilirubin. Because as I said earlier, bilirubin would not be able to bind in case magnesium binds because it acts as a competitive receptor antagonist. Methodology
So,
over to. Yeah.
thank you. Good evening, everyone. This is Anurag from second year. I'll be continuing this topic by talking about the methodology. The timeline was from March 2017 to September 2018. The location of the study, where the study was conducted, was in neonatal department of Besat Hospital in Hamadan, which was located in the west of Iran. The sample size was 160 neonates. The inclusion criteria, the neonates were selected, those who were healthy term neonates with hyperbilirubinemia, weighing more than 2.5 kg, and at a birth age of 2 to 14 days were included in the study. Coming to the exclusion criteria, um, if there was any abnormality of ABO and rhesus RH factor, or if there was a glucose 6 phosphate dehydrogenase deficiency, or any evidence of any lysis in the test, such as hemoglobin reduction, etc., history of magnesium sulfate consumption in mother, the use of any other medication during admission, or the presence of any other signs other than jaundice, then the neonates were excluded from the study. Next, division of study subjects. This was based on total serum bilirubin concentration. Based on this, three groups were made: mild jaundice, moderate jaundice, and severe jaundice. Mild jaundice group had a serum bilirubin concentration of 15 to 18 milligram per deciliter. Moderate had 18 to 20 milligram per deciliter, and severe jaundice was more than 20 milligram per deciliter. There were 52, 57, and 51 newborns respectively in each of the groups. The neonates having mild jaundice were treated with single phototherapy, which is a phototherapy method consisting of four lamp device. Double phototherapy was used to treat neonates suffering from moderate jaundice, and double phototherapy has two three-lamp phototherapy devices on both sides, upper as well as a distance of 15 to 20 centimeter from the newborn. And intensive phototherapy was used to treat neonates suffering from severe jaundice. And intensive phototherapy had 8 fluorescent lamps, 4 lamps from the upper part and 4 lamps from the lower part. Coming to the instruments which were used, the serum bilirubin was measured by photometry method. The serum magnesium levels were measured by atomic absorption spectrophotometry. And the phototherapy method was basically where the fluorescent lamps were placed above the heads of uh, the neonates with full coverage of the eyes and genitalia. The treatment criterion was that the total serum bilirubin levels should reach below 12 milligram per deciliter. Now, the results.
Yeah. So coming to the analysis and the results part. So let's move on to the statistical analysis. So whenever we do a research project, we try to tabulate our results and the data in Excel sheets. So the first step is all after this is always data cleaning, where replacement, modification, and deletion of data occur so that we can maintain uniformity. I'll just give an example of this. For example, let's say a very simple research with Google Forms, for example, and we're sending it out as a survey. So there is one column where you're asked to fill in your gender. Some people might write F, some people might write female, some people might write it as capital F, some people might write it as small f, and all that. Right. So all these would be considered as different variables by the software that carries out the data analysis. So that is why data cleaning is done so as to maintain a uniformity, isn't it? So this was just a very small example. So this is how it works. After which the data, after being cleaned, was transported to IBM SPSS version 22. So this is a statistical data analysis software. Over here, we like the data is analyzed and we come to the final results. And the variables here were divided into two. So one is a quantitative variable. So a quantitative variable is a variable that can be expressed as a number. For example, age is a number. So it can be expressed as an amount or a number. So these variables are always expressed as mean and standard deviation. Mean is average, and standard deviation is like when you write plus or minus, so it is the maximum extent to which the data can extend, like in either direction, positive or negative side. Qualitative, on the other hand, is a type of variable where it cannot be expressed as a number. For example, gender or race, it cannot be expressed as a number because it's a qualitative parameter. So these variables are expressed as frequency and percentage, right? So after the data analysis is done, we use a paired t-test. And in the paired t-test, the significance level was considered as 0.05. So what it means is that whenever the p-value is less than 0.05, it is considered to be significant. The correlation between those two variables is considered to be significant. I'll just give an example. There's a table here. So in this table, the total serum bilirubin levels before and after single, double, and intensive phototherapy were tabulated. So as you can see in the single phototherapy, the bilirubin level had decreased by 7.83. So go to column number 3. Okay, you can see differences written. Like, don't see before and after for now because it's a lot of numbers. So just see differences, the column differences for now. You can see minus 7.83. That means in single phototherapy, the bilirubin level had decreased by 7.83. Similarly, in double phototherapy, it had decreased by 9.67. In intensive, it had decreased by 13.55. And in all of these, you can go to the next column. Okay, so you can see something called P. So P value basically finds out a correlation between two variables. So the two variables here are the phototherapy and the difference in the serum bilirubin. Okay, so as you can see in all of these, the p-value is less than 0.001. And I had already mentioned previously that significance level was 0.05. So whenever it is less than 0.05, the association between the two variables is significant. And over here, it's obviously very significant because it's less than 0.001 also. Right. So you can conclude in words that all the three types of phototherapy have been significant in decreasing the serum bilirubin levels. Now we'll go on to the next table. So this table tabulates the serum magnesium level before and after single, double, and intensive phototherapy. So over here, again, like don't look at before and after for now. Like just see the differences column. In single phototherapy, the serum magnesium level decreased by 0.02. In double phototherapy, it decreased by 0.13, and in intensive, it decreased by 0.02. And p-value in the first one is 0.5, which is not statistically significant because I had already told it should be less than 0.05. So exclude that. In intensive also it's 0.5 something, right? So exclude that as well because that is also not statistically significant. But if you can see double phototherapy, it's 0.018. So that is less than 0.05. So that is considered statistically significant. So we can conclude that double phototherapy was significant in decreasing serum magnesium levels, uh, like after the phototherapy was done to the neonates. So why we have insignificant results in statistics is because of a lot of different reasons. It is not necessarily associated with this. It could be because of many other reasons. For example, the type of instrument used, any other peripheral reasons, which is not relevant to this. So that is why we say it's not significantly correlated with this variable. And like the reasons and everything, Anurag will be explaining in his part in after a few slides. So it'll be even more clear to everyone. Vivekun, can you hear me? Am I audible?
Yes, Malvika, you're audible.
Okay, because I'm trying to like change the slide. I don't know why. There's a small glitch, so that's why I was.
Okay.
Uh-huh,
Yeah,
one
now
second.
it's fine.
Yeah. Yeah, so again, summarizing the results because it was all in tables in the previous two slides. So I'll just be summarizing them in words once again. So 160 infants were taken for the study with a mean age of 38.76 weeks. They were all like neonates. And the bilirubin decreased in all the groups after phototherapy. That was what I had shown you all in the first table. And magnesium decreased in single and double phototherapy, but it slightly increased in intensive phototherapy, but the single and intensive ones were not significant, so that we can exclude. So we'll just focus on double phototherapy. So the magnesium level significantly decreased only in double phototherapy. And over to Anurag for conclusion and scope.
Okay, so coming to the conclusion scope. So the discussion part of it, there is a rise in serum magnesium levels in hyperbilirubinemia, which may be a physiological compensatory mechanism. It is hypothesized that there is a positive relationship between serum bilirubin and serum magnesium levels. And the rising of magnesium during hyperbilirubinemia, it may be a physiological compensatory mechanism that counters the toxic effect of hyperbilirubinemia. And there is insignificant findings in single and intensive phototherapy. This is due to delay in blood sampling. Here it was mentioned in the study there was no additional blood sampling that was performed. It was only once. Then coming to the other point, increase in serum magnesium levels in intensive phototherapy is due to magnesium leakage. This magnesium leakage was caused by the release from damaged neurons as well as RBCs to exert its protective effect on the nervous system. Oral magnesium supplementation may also be recommended, and head can be covered during phototherapy. The reasoning behind the covering of head during phototherapy is that it is hypothesized that the one when the head is covered, the light does not reach the pineal gland, which causes the melatonin levels to remain high. Melatonin has a positive relationship with magnesium levels also. So when there is high magnesium levels, when there's high melatonin levels, there will be high serum magnesium levels also. So coming to the limitations, the use of only conventional phototherapy devices and other devices such as optics phototherapy were not used. There was only conventional phototherapy devices which were used. Only healthy term neonates were considered. Those having any other pathologies other than jaundice were not considered. They were excluded from the study. They did not take into account the diurnal variation magnesium levels. And the study was conducted only in one center, which was in Iran.
I've actually changed the slide. I don't know. I think there's a very slight glitch. It'll come in like a few seconds or so. Oh yeah,
Okay.
conclusion.
Okay, coming to the conclusion part of it. Severe jaundice can cause neurological damage and connectors also. This is due to bilirubin deposition in the membrane of the neurons. Bilirubin exerts its neurotoxicity by binding to the N-methyl D-aspartate receptor in the neural synapse. Magnesium is one of its most important antagonists of this receptor. The body increases the level of extracellular magnesium to reduce the neurotoxicity effects of bilirubin, and this is a defense mechanism. And magnesium levels showed a significant reduction only in double phototherapy and remain normal in the other two groups. Coming to the scope of the paper, there is a potential presence of the defense mechanism by which body increases the concentration of magnesium to reduce the bilirubin neurotoxicity. This is hypothesized, it hasn't been proved yet. Potential of magnesium to supplement phototherapy in hyperbilirubinemia. As I said before, oral supplementations have been recommended uh, before, and it also paves the way for future studies to find alternatives to phototherapy.
Yeah, and adding on to this, like the, yeah, the generalizability of the result. So the results actually cannot be generalizable because of the limitations that we mentioned previously, and the study is also one of a kind. Like it's like such a study has not been done before with regards to phototherapy and serum magnesium in neonates specifically. So this study basically just explores the like possibility of defense mechanism firstly. So that's why we mentioned it as potential presence, because of the presence of the defense mechanism has not been exhibited yet. So it's just a potential presence that the study is exploring, uh, by which the body could increase the serum magnesium levels in order to reduce bilirubin neurotoxicity. So in the absence of phototherapy, the magnesium levels had actually shown a rise, but with the phototherapy it actually decreased. So this study like gives us a possibility that there could be a defense mechanism that in the absence of any other external stimulation, for example over here it was phototherapy, the body could increase the concentration of magnesium to reduce the bilirubin neurotoxicity. So this is what the study tries to explore, and also it paves the way for other studies to like showcase whether magnesium supplementation in addition to phototherapy could help in hyperbilirubinemia. So we thank everyone for their patient listening. We thank ma'am a lot for coming, like despite her busy schedule, and also the PGs, our seniors, juniors, and batchmates. Thank you.
An excellent presentation, Malvika and Anurag. Uh, So, in this presentation, you had extensively talked about phototherapy and the actions of magnesium on NMDA receptor. Malvika had also extensively covered about the statistics part of it and how magnesium levels decrease significantly after double phototherapy and why this leads to scope of oral supplements of magnesium being used in infants undergoing phototherapy. So, Sahana ma'am, do you have any questions or would you like to comment?
Good evening, dear students and Sushma and Prashant. Yeah, thanks for this opportunity and excellent presentation by our undergraduates. Being in second year, we were exposed to the journal club presentations only during our postgraduate days. Okay, excellent job. And selection, maybe you could have done a little better one. And regarding your critic, how to critique, how was the title, maybe little bit you can say, and what about the authors and sample size, so in the end, maybe you can see, but that will come as you do. But for the first presentation, this is your first presentation, is it? Can you hear me? Hello?
Yes, ma'am.
Yeah. Is this
Yes,
your
ma'am.
first presentation?
Yes, ma'am. This is my first
Yeah,
presentation.
yeah, excellent. All of you, all three of you did a wonderful job. Good job, and you can continue to do. But the magnesium even we do because phototherapy is the first most common treatment in the NICUs. Yes, so it has got more side effects other than the hypomagnesemia causes very minimal issues. Transient. So we don't worry much and go on taking the blood, taking out blood for all these investigations would be so much. And instead, the common side effects are phototherapy rash, like a skin rash, flea bite rash, okay, and then transient lactose intolerance, which causes greenish loose stools, okay. And in the flaws of the study, or I mean, they have not mentioned whether mothers were on the magnesium, because PIH moms will be on magnesium sulfate, and as a neuroprotective, we give for the antenatal magnesium sulfate. And even hypocalcemia is a feature in many magnesium can be low in magnesium can be low in the mothers themselves and IUGR babies who are born. So these are some of the criteria which they have not taken into account. That's what I felt. Okay. And
Yes, ma'am.
yeah, what does it, when do you say hypomagnesemia, what level have they mentioned?
No, ma'am. They haven't mentioned it in the
Yeah,
paper.
yeah. So it is, very minimal, like low when what we say is less than 1.6 milligram per DL. So very few babies can have apnea, but we don't see because it causes sometimes hypocalcium and magnesium both are interrelated, right? Because of its
Yes,
effect, it inhibits the pineal gland and then in turn the melatonin and reduce cortisol and in turn causes hypocalcemia. Okay, so that is how the mechanism goes. And in preterm babies, patent ductus arteriosus gets opened. So some of these things we consider, and phototherapy is the best treatment for neonatal jaundice. Okay. Next comes our exchange transfusion if it is there, and we don't treat for 15, 12 and all. So there is a bias amongst that, and the selection of the criteria not that great. Okay. So and it was done about 5 years back, and you should take the most recent ones, right? Thank you so much for the opportunity. Well done,
Thank you,
Sushma.
ma'am.
thank
Can
you
you
so
just,
much, ma'am.
yeah, Sushma is, and they can give a comment.
I don't think Sushma ma'am has joined the meet, ma'am. I think she was having some technical issues today. Uh,
Anyone else?
yes. Does anyone else in the audience have any questions or doubts? Which
Sir
if
must be there, no? Prashanta. Sir is there?
no, ma'am. So has
Moderators. Okay, so we don't just, yeah, this is for you people to know. Phototherapy is the best option. And we have depends on the phototherapy, depends on the current guidelines is there, AAP guidelines, okay? American Academy of Pediatrics. You have to, it depends on the gestational age, hour of life, and the risk factors. Okay. So depending on that, we do, and it's an antioxidant. Bilirubin is an antioxidant to a certain extent. If it reaches beyond that, and depending on the hour of life and the gestational age, okay, and the risk factors like your perinatal asphyxia, okay, so like that, and blood-brain barrier, meningitis, sepsis, these are some of the reasons, and preterm low birth weight babies, no. So depending on the gestational age, we classify and then give. It is not like mild, moderate, severe. We don't do like that because it is different. There are AAP guidelines. Please go through that. Okay.
Sure, ma'am. I will.
Yes, ma'am.
Yeah. Thank you so
Thank you
much.
so
Well
much.
done. Huh?
Ma'am,
Yeah.
thank you so much, ma'am,
Yeah.
like
Very
for
well
coming
done.
despite your busy schedule.
Yeah. 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 Okay.
Yes.
Thank you, ma'am.
Yeah, about 70% of the babies are jaundiced during
Yes.
neonatal period. Okay. Only 10 to 20% of them require phototherapy, and more so preterm babies, right?
Yes.
Yeah.
No, I have a small doubt
Yeah.
actually.
Yeah. You can ask. Yeah.
Yes, ma'am. Ma'am, like sometimes we also like whenever we have like babies at home, like we
Yeah.
like put them at the terrace so that they can get the sunlight. So is there any
Yeah.
difference
No,
between
no
giving
role
them
for
sun?
sunlight, dear. No role for sunlight at all.
Okay, okay.
Yeah, it will cause more of, because there is a certain specifications, wavelength and the irradiance is important in giving phototherapy. Okay, so wavelength should
Yes,
be around 420 to 490 nanometers. In that wavelength only, that phototherapy acts. Okay, blue green light is what we specify, and the irradiance should be at least 8 to 10 microwatt per centimeter square per nanometer. Okay, that is the irradiance that will be checked by our flux meters. And sun is miles away, right? So
yes,
it cause more of harmful UV rays, and baby can become hypothermic, hyperthermic, which is more dangerous. And even the lights, what they have specified, no, we don't use that for all this. Before we had conventional phototherapies, okay, so we had four blue lights and single surface, double surface. Nowadays we have moved out and we are using the compact CFL lights or LED. LED is a friendly. It doesn't harm the eyes of the people taking care, nurses when they feed and all that. No, so
yes,
these are the lights which are used right now, and it should be intensive means very less. The distance we reduce. Okay, and it
yes,
depends on the which day they have taken and which day they have done, because it will show the maternal magnesium depending on the initial. No, first day it is different. First week it changes magnesium. So there are a lot of bias in this study. Okay, at
yes,
birth usually it is around 1.44 millimoles per liter, like that.
yes,
And even maternal initial 1.29, like that it is. And determinants of the neonatal magnesium depends on the maternal supplements also of the magnesium. Calcium also they'll be giving, no, so like that, right?
yes,
And for jaundice, phototherapy and exchange only, that's what we teach when you guys come to our clinical side. And no role for your drugs like phenobarbital. Recently I had a panel discussion in the national conference. Yeah. Okay, no role for
yes,
clofibrilate or
yes,
phenobarbital. Only phenobarbital we use in Krigler-Najjar type 2, right?
yes, ma'am.
Because babies get sedated, it will come in the way of your breastfeeding. We are all breastfeed friendly.
Yes,
So you should not give phenobarbital. It will sedate, right?
yes,
So
ma'am.
no role for the drugs as of now. Tin metalloporphyrins, all that is no. It is just in the study mode, and no role for sunlight. Tell your any neighbors or your sisters, brothers if they deliver, no, just keeping in the sunlight. Doctors themselves don't know. Many of them.
Yes, ma'am.
Yeah,
Yeah.
ಎಳೆ ಬಿಸಿಲಲ್ಲಿ ಅಂತಾರೆ, which is of no use.
Okay. Yes.
Right?
Yes.
And you can just say. Then phototherapies are friendly nowadays, LED, because it can be put on the home phototherapy is also there. Billy blankets next to the mothers are also there. But what we use in our hospital is LED. It has been because the longevity of that is more 18,000 to 20,000 hours, because we'll be continuously giving, no, for the load what we have. Right?
Yes, ma'am.
Okay. Anything else? Students want?
I I have one more doubt actually
Yeah.
regarding the this light itself. Like
Yeah.
nowadays, the sunscreen for babies it's actually becoming very popular. So
Sunscreen lotions, is it?
yes, ma'am. Even for babies, it's becoming very
No,
popular. Is it really
no,
necessary as it
no,
is for us?
not at all required, dear.
Oh,
Because the way babies get the acid mantle, no, the skin takes
yes.
its own time, nothing, no irritants, no hot water. It should be lukewarm water and only some emollients, gentle cleansing, no soaps also. There are certain things. Syndex are to be used, not the strong soaps.
Oh,
Okay, skin
yes.
of a baby is very, very, very delicate, right?
Yes,
So
ma'am.
no role for all that. Only oil massage, time tested. Our grandparents, grandparents used to
Oh,
give no coconut oil.
yes,
So I'm
ma'am.
doing a study on coconut oil right now in our NICU. So we do use. Okay. So
Yes.
coconut oil, especially for preterm low birth weight babies. Okay. So
Yes.
it will just stimulate the sensations, etc. And coconut oil is the one which we say, right? No role for sunscreens and all. Baby doesn't go to beach, no?
Yes, ma'am.
Yeah.
Yes.
Anything else?
That's it, ma'am. Thank you so much.
Yeah. Thanks.
Thank you,
Thanks
ma'am.
for the opportunity. Can you share the slides so
No,
that I
sure,
can tell
ma'am.
my postgraduates how they have to do a journal club?
Sure.
Just their cut and paste.
Yeah, thank you so much, ma'am. I'll share
Yeah.
it to you.
Yeah. Yeah. Send it to me. Okay.
Good
All
evening,
the
ma'am.
best. Yeah.
Hello. Good evening, ma'am. This is Pratik, ma'am.
Yeah, Pratik. Oh, you are there. Huh?
No, ma'am. Just wanted to join the meet and tell you thank you, ma'am, for
Yeah.
supporting the juniors. The juniors have been doing really well with journal clubs and such meets, ma'am. They've been doing it across like various.
So you should take part in our conferences and all.
Ma'am,
Okay.
they are, ma'am. They are actually very interested now.
Yeah.
Actually, JIPMA
Take
conference.
some studies, QIs, man. Quality improvement.
Yes, ma'am. I'll like inform them about it and how to go about with it.
Yeah, yeah. So any
Uh,
research and all, no, you please come and talk to us, clinical side, because you guys will be exposed only to microbiology
yes, yes, ma'am.
and pathology. So
Yeah,
better come to
true,
us.
true,
We
ma'am.
can do a quality improvement and small, simple things will yield better dividends. Okay.
Yes, ma'am.
Yeah.
Thank you so much, ma'am. Thank you for supporting the juniors as well, and
Yeah.
thank you for like moderating this. I just
Yeah.
want to come on this call for that, ma'am.
Yeah. Thank you so much, Pratik. And
Thank,
thank dear students.
thank you.
All the
Thank you
best.
so much for your valuable inputs, ma'am. I hope everyone in the meet learned a lot today regarding phototherapy.
Yeah.
Yes, ma'am.
Thank you. Yeah.
Thank you
Thank
so
you so
much,
much, ma'am.
ma'am.
Thank you. Yeah.
Thank you,
Bye.
ma'am.
Bye. Bye.
Bye.
Yeah.
Shreya, ma'am, or would you like to
Ye-
add something?
Yes. Hello, guys. It was Malvika and Anurag. It was a good presentation. I was very keen on seeing how you guys will do the PPT after the, the workshop. So I just want to say a few things. Like the flow of the presentation was good. The flow charts that you included was good. They were clear images, and obviously you maintained a uniform font style and size throughout the presentation. So it was really nice. And the information that you gave, especially at the beginning of the presentation regarding phototherapy, bilirubin, NMDA, and everything, that was clear and concise. So kudos to both of you on that. I had a few doubts. Like, for example, we have different checklists for different study designs, correct? So
Yes.
this was a prospective cohort, right?
Yeah.
So did you?
We use
Why was the checklist not?
strobe checklist, ma'am. We use strobe actually.
Okay, so
Yeah.
it's ideally you're supposed to mention what checklist you're using for the study design. And if I remember correctly, when I had attended Satvik's presentation, he had done for each point, he had told whether it was there in the article or not, correct? So that is usually done for all journal clubs. So next time maybe you can incorporate that. Like for example, when you start with the thing, there is title, correct? So
Yes.
title you'll comment if all the things that are supposed to be in a title are there, like study population, study design, and the objective is clear or not. And then abstract, you'll say whether it is a structured abstract or non-structured. Structured meaning all the headings are there clearly, like aim, objectives, and conclusion. And then introduction, you will comment on whether the rationale for doing the study was clearly given in the article. Like I understand that you read about it and you told us what has to be done. Like this is alternatives to phototherapy, this is what is there. But whether they have said it in the article, that is to be mentioned. So this comes only if you completely thoroughly follow the stroke checklist. So that is one thing I felt. And obviously, as ma'am mentioned, the sample size, how they came into the 116 units, how they came into the calculation has to be whether they have done it. With in this article, as far as I know, they have not commented
They
on
have
how.
not mentioned, ma'am.
So usually Sushma ma'am, what she tells us is if it's not given in the article, you have to do a search and you have to come to the sample size and then mention whether it's correct or not. So that is something that you're supposed to do.
Yes.
And what else? Report outcomes. That was few things that I wanted to say. Yeah, and statistical tests. You spoke about paired t-test,
Yes.
or yeah, paired t-test. There's one more test that was mentioned here,
Magnesium.
Magnesium test. I figured
I
that it
did
would
that
have been
on
a little,
purpose, actually.
yeah, maybe it was a little difficult for you to understand, so
Right.
you kind of skipped the whole. You didn't even mention it. So if Pushpam was there, she would have definitely picked it up. So even if you can't, read up about it, or goes beyond your level, at least mention this such as such. This test has been put, because the table, that is the main table in this study, like before phototherapy and after phototherapy, what was the significance that was seen. That is
Yes.
what's important here. And from what I read, McNemus test is basically for checking the difference in the proportions of categories in two groups. Like in table 4, if you see, before phototherapy, less than 1.5, 1.5 to 2.2, less than 2.2, something like that is there, correct? And
Yes.
after phototherapy, there is again less than 1.5, same categories.
Yeah.
Double phototherapy, if you see, less than 1.5, it was 1, and later it has become 3, and 32 has become 44. So this significance, this to check this significance, McNemus test has been used here. And in this, it is 0.003 only in double phototherapy type. So I understand it's a little difficult for you guys since you're just starting to read about all this, but yeah, I just wanted to brief you.
Yes,
And one more
I
thing,
actually understood it better now.
and one more thing, usually when you start with a journal, you tell the impact factor of the journal, correct? Did you find the impact
No,
factor?
actually, we couldn't find the impact factor, so that's why I just told it's PubMed Central Index. I tried to find it, but I was not
Okay.
able to find it actually.
Okay, this is another interesting thing that I found. Even I tried to check the impact factor. If you click on the International Journal of Pediatrics in the article that you see, you get something called as journal citation indicator, which is given as 0.700. I hope all of you can check when, if not now, later on you can check. And impact factor, they've not given. So I went back and studied a bit about journal citation indicator, and apparently it's the latest thing that's coming up from 2021. All journals are trying to give a journal citation indicator. It has few differences compared to impact factor. You can probably read about it, like few differences, like in impact factor we consider uh, articles published in the 2 previous years, right? But
Yeah.
in the citation indicator, it's taking 3 years. And there are few other things like that use category normalized indicator, like for each article and review article, they are categorized based on the publication type, the year, and it's one more thing, category of article. So it's supposed to be a better indicator rather than impact factor. We can read about it the next time. So next time, if you don't find an impact factor, you can tell that it's not being given, or if a journal citation indicator has been given, you can say that. So whatever is given here, 0.7. So basically, if JCI, that is journal citation indicator, is 1, it means the published papers across the journal, they receive citations equal to the average for that category, whatever is that. So less than 1 is below expected, and more than 1 is better than expected. So here it is less than 1.
Yes.
So I just wanted to, because I'll remember it better if I tell it to you guys. So I just wanted to share. That's all.
Awesome.
Good presentation, very clearly communicated, both of you. And congratulations on doing it successfully. I'll see you guys tomorrow.
Thank you so much, ma'am.
Thank you so much, ma'am. We'll keep these points in mind.
Yeah, yeah,
Thank you, ma'am. I
yeah.
would like to thank all the students who attended this meet. I would also like to thank Dr. Karthik sir and Dr. Shreya ma'am for attending today's meet. Thank you, everyone.
Yeah.
We can end the meet now.